Blood maintains a very narrow pH range, and it does that through the buffering of the bicarbonate buffer system. Cellular respiration produces carbon dioxide as waste, and the dissolved carbon dioxide produced during cellular respiration travels through the bloodstream to the lungs. That carbon dioxide will dissolve in water to form carbonic acid and water, and there is a similar concentration of bicarbonate ion to the carbonic acid in the blood. So we have this equilibrium situation between a weak acid and its conjugate base. If someone hypoventilates, that means that they are not allowing enough carbon dioxide to be expelled. Then the carbon dioxide builds up in their system, and the carbonic acid concentration increases, and that causes a shift to the right of this equilibrium. That causes an increase of the hydronium concentration, which of course causes the pH to lower, and that causes a condition known as respiratory acidosis. This can be treated with intravenous bicarbonate. If we add bicarbonate into the bloodstream, it will cause this equilibrium to shift back to the left. A person who hyperventilates exhales too much carbon dioxide, so gets rid of too much carbon dioxide. And what this is, this causes a shift of this equilibrium to the left, and our concentration of hydronium decreases, which means our pH increases and the blood becomes more basic. This is known as respiratory alkalosis. So this can be reversed by having someone breathe into a paper bag, not a plastic bag, a paper bag, which keeps some of the previously exhaled carbon dioxide available for the next breath. And so by breathing in more carbon dioxide, that allows that concentration of carbon dioxide to increase, and thus will cause a shift back to the right to stabilize the concentration of hydronium and the pH levels in the blood. This condition, caused by hyperventilation and exhaling too much carbon dioxide, is known as respiratory alkalosis. Blood pH can also change due to metabolic features. So for example, diabetics, because their insulin is not working properly, their bodies will often use fatty acids for energy, and when those fatty acids are broken down, more acid is produced, and this can cause metabolic acidosis. So again, anytime there's too much acid in the blood, we can administer bicarbonate to cause the reaction to shift to the left. And metabolic alkalosis, where the reaction is, the equilibrium is shifting to the left, so the concentration of hydronium decreases and the blood becomes more basic, can occur with different factors such as excessive vomiting. So table 9.10 in your textbook summarizes the different symptoms, causes, treatment of this bicarbonate buffer system in your blood.